Rib contusion. Caused by a blow to the ribs is severe enough and may cause a fracture. Both expiration and inspiration are very painful when the intercostal muscles are bruised. Anybody ever go eat barbecue? I mean, we are in Texas. You don't eat barbecue. Something's wrong with this one. Something wrong with her. Something wrong with her. All right, there we go. Finally, somebody's got some sense here. When you're eating ribs, right? You've got bones, and then they're really not. They're not. They're good. So, talking about ribs. Let's get focused. So, actually, I cut them off so they're nice, good ribs. If you know how to do it, you butcher quite a bit of the meat, and then you. But anyways, so there's the bones, and then in between is the meat that you're eating, and that's the same as with us. Okay. So we can feel the rib bones, and then in between the rib bones, you just can't keep poking all the way through and tickle a lung or anything because there's muscles there. So what are those muscles there for? The muscles are not there to protect your inside. It helps with breathing, sneezing, laughing. Yes. They pull the ribs together, right? Which then when you sneeze, you feel all of your thoracic muscles just so it increases the pressure inside and forces out your sneeze. All right? So inspiration and expiration. Inspiration is inhales, and expiration is when you exhale. So if you've got a contusion, either to the muscle or the bone, especially but to the muscle, when you laugh, when you cough, you're going to feel that. If you got a fracture, you're really going to feel that. So signs include a sharp pain when breathing, point tenderness, and pain when the rib cage is compressed. I don't have anybody here that I can do this on. So you would take one hand, put it in front, one hand, put it in back, and you squeeze to see if they have any rib pain over here. If they've got a fracture, you very well may feel crepitus, where it gritty, feel it pop. Comprende? So, how do we do that? Well, rice. All right, X-ray to rule out a fracture, anti-inflammatories. These respond best to rest. Wear rib protection when you return to activity. Not a whole lot that you can do with these. It's not like you can tape them up. They're not a joint. And taping is only for limiting the motion in a joint, not for limiting the motion in ribs. So if you got a fracture caused by a direct or indirect trauma and can be the result of a violent muscular contraction, must be cautious with rib fractures for you might get a hemothorax or a pneumothorax may result, which is a collapsed lung. That's not good. If you get air inside of your thoracic cavity and that air is greater in pressure than what the lung on the inside is, it will push the lung to collapse. So, huh? Yes. So you got something that's inside that, well, she's got a story about that, right? So It's important that you don't blow these off. It's just like a wrist injury. People blow off, and we talked about that. You blow off the wrist injury, actually, they have a fracture. You blow this off, they actually have a hemo or a pneumothorax, where you get a collapsed lung. You get a collapsed lung, think of that. You can't breathe then. You're having a tough time. So off to the ER they need to go. Your signs include severe pain during inspiration, and you have point tenderness, severe and sharp pain, and possibly crepitus during palpation, to where when you push on the rib, you feel it go. All right? Management includes referral to your physician, followed by your physician's protocol. If that means that they are in complete rest, they are in complete rest. You can't take an ACE wrap and wrap it around somebody and say, okay, you're good to go. No. So, rib fractures, don't blow them off. Kidney contusion. How many kidneys do you have? You should have two. Okay? How much kidney do you need? Less than that even. Less than that. No, not that. A tenth. If you are healthy, all right, healthy. Yeah, like that kind of thing. Like, stop. So, if you are healthy, you don't have high blood pressure, you don't have high cholesterol, etc. 10% of one kidney will get you by. 10%. Yeah, you probably can't. Kidneys are important. Think of this. I mean, here's my question about kidneys. You got two of them. You don't need both of them. You don't even need half of. You say you need only half of one, right? Why shouldn't you be able to sell them? My kidney, right? You need one. I'll sell you one. Why? I don't know exactly why, but probably has to do with, well, the rich keep getting living longer and the poor just keep getting it in the shaft. It wouldn't. I think it would probably take away from donors. But if you've got bad kidneys, you're going for dialysis. Kidneys clean your blood. And if your kidneys are bad and you have kidney disease, you're going to get one needle in your arm, your blood goes out, it gets cleaned, and it comes back in. Otherwise, you're living life, living large. Well, she likes to go on vacation. Loved to go on vacation when she was younger, but now that she's 56, she can't go on vacation because she has bad kidneys. Why can't she go on vacation? She's got to get her blood cleaned all the time. People will pay big bucks to where now you have the freedom to be able to go places without being tied to a dialysis regimen. No. You can donate your kidney, give one to somebody. You don't have to be dead to give one to somebody. There's a coach that I know that when he was right at 60 years old, he decided, I'm going to give this person my kidney. Went in, took his kidney, gave it to her. Kidney contusion. Because of normal distension of blood, the kidneys are susceptible to injury, meaning that you got a balloon filled with air. You can punch it, pop it, not pop it, but push it all over the place, right? But you put water balloon in it, you got to be more careful, a little heavier. And the water inside that balloon has its own mind also, just like a kidney. So now that with the kidney full of blood, you've got to be careful about getting hit on them. The body does a really good job of protecting it because it's up underneath the ribs. An external force applied to the back of the athlete will cause or can cause abnormal extension of an engorged kidney, resulting in injury. The degree of injury will depend on the extent of the distension and the angle of the force of the blow. don't think I've ever had somebody who's gotten a ruptured kidney. But have you had one? A ruptured kidney? Lacerated liver, but not a kidney. Those aren't fun either. You're going to find their blood pressure drop. They're not feeling right. Obvious pain, distension. All right. So if they're starting to bleed within their stomach, have them lay down, facing up, and you're going to push on their belly. And those hard spots is where the blood is. If you find a hard spot, you're better off to say, I'm not sure, but I think this is a lot harder than what it should be because the rest of the belly is not this hard, and send them on their way than it is to have somebody bleed out on the sideline. Signs of a kidney injury include shock, nauseousness, vomiting, rigidity of the back muscles, and hematuria. You know what that is? When they go potty, they have blood in their urine. So that's not a great sign, obviously. And if that occurs, you need to go straight to the doctor. 24 hours observation in the hospital and a gradual increase of fluid intake. They may have to have surgery if the hemorrhage and bleeding does not stop. All right, spleen injury. Anybody got a spleen? Not everybody's got a spleen. You can lose your spleen. Huh? Why? I was going to say, it was a car wreck. So spleen injury, most often caused by a fall or direct blow to the upper left quadrant of the abdomen. If you get infectious mononucleosis, it inflames your spleen. So if we get guys that come in here and they've been, I know that mono is the kissing disease, but you put your hands to your mouth so many times during the day that you don't even realize it, and you're going, oh, I just opened the door. Oh, that should be clean. There's some mono. So, exactly, shaking hands, etc. Infectious mononucleosis is the most likely cause for spleen enlargement, and the signs of a ruptured spleen has to be recognized so that an immediate medical referral can be made. And signs include nauseousness and vomiting and curs. Okay, you can see that's in red, so that would probably tell you that it's certainly something that you want to highlight, not in red, but in yellow. Signs also include a reflex pain approximately 30 minutes after the injury called Kerr's sign, which radiates down the left shoulder and 1/3 of the way down the left arm. So all of a sudden you've got this pain that's over here and it just comes, what is that? But I didn't do anything to my shoulder. So those are some of those deals. If you can narrow it down, I got hit over here and now I hurt way out here. I've not seen one. My father saw one. He had an athlete that went home after the game and came back and called during the night and said, I got pain bad and etc. And yes, and so he had to go in for surgery and lost his spleen. Complications include the spleen's ability to splint itself and then produce a delayed hemorrhage. So the spleen sits there and he says, dude, why'd you hit me? All right, well, I'm mad at you, but until I get really mad, I'm going to sit here and I'm going to try and put some Band-Aids on. It's like putting Band-Aids on a broken arm. It's not going to stay. It's just not going to work. So later, as it tries to splint itself, it just says, I can't do it. And then you get it. So it could be a day later. So this can cause death from internal bleeding days or even weeks after your initial injury. If you've got something that's bothering you as far as an athlete, or if one of your athletes has something that's bothering you is abdominal, see the doctor. So management is conservative, and a week of hospitalization could be recommended. At 3 weeks, the athlete can engage in light conditioning drills, and at 4 weeks, the athlete possibly could return to full activity as long as there's no more symptoms. It's just a spleen, though. Yes, They take time to heal, just like everything else. But you can't, you got an ankle injury, you're able to see the ankle injury. Spleen injury, there's not a little portal that you can just open up and say, hey, is everything good in there? And then push it back down. So you've got to be careful. All right, a blow to your solar plexus. Has anybody of you ever lost your, got the wind knocked out of you? Yeah. Isn't it exciting? You didn't like it? What did it feel like? It hurt like someone stepping on you? How was your breathing? You could not? You can exhale. So you can exhale, but you have a really tough time inhaling. And they go crazy. They freak out. The athletes freak. I can't breathe. Relax. It'll come down. You just got to get you to settle down. So a blow to the solar plexus produces a transitory paralysis of the diaphragm. The diaphragm sits underneath. All right. It separates your thoracic and your abdominal cavities, and it helps with breathing. Signs include athlete unable to inhale, and then they get hysterical because of the fear. Management includes helping the athlete overcome the apprehension by talking in a confident manner. You can, I don't know why they put this on here, but loosen the athlete's belt. You know, I don't know about that. And clothing around the abdomen, and you relax the athlete. The biggest thing that I like to tell them is that once they start to be able to breathe, is I tell them, I say, all right, let's slow down. Let's think of a clock. Tick, tock. I want you to breathe in on tick, and I want you out on top. Tick, tock. And you tell it to them, nice, slow deal. It helps them to relax. Yeah. All right? And now they're not getting into hyperventilation. So you go from one to the next. Commotio cordis. You can thank Ms. Bates for adding this over here to it. Commotio cordis. It is not a martial arts fighter. Although there is a YouTube. Put on your YouTube and look for Commotio cordis on YouTube, and you will see a martial artist fighting, and he got punched in the chest, and about 5 seconds later, in the 5 seconds, he went back to his spot and then fell down and died. Yes. All right? So, commotio cordis is caused by a blow to the chest directly over the left ventricle of the heart that occurs at a certain point of a person's heartbeat. The blunt force causes a lethal abnormal heart rhythm called ventricular fibrillation, AED, and you got to have it right there and have an idea of what's going on. Otherwise, they die. If you don't know commotio cordis, they get hit in the chest, and that's not one of the things that comes through your repertoire. Okay, got hit in the chest. Well, what the heck caused him to fall down? All right, solar plexus. No, he's not breathing. So, hyperventilation. No, commotio cordis. Very well could be. You got to slap that AED on him quickly. Huh? 24%. So, the force of the blow up to the chest is common at speeds of 35 to 40 miles per hour. Do we have any sports that can, here on campus, that at 35 to 40 miles an hour could hit you in the chest? Like what? Baseball, softball, tennis. Don't know if the mass of the tennis ball is big enough, but the speed. Football? Football, maybe you block a punt. Yeah. Yeah. Now, if we're talking, because here it says is that the force, and we know that may the force be with you. that force equals mass times, huh? No. E- Either acceleration. I always learned it as m equals f times v for velocity. Because the acceleration, it might be decelerating, but it still has a velocity. So baseball, only 9 ounces, right? But what if we change that to 9 pounds? So it could be 10 times slower. According to U.S. U.S. Commotio cordis registry, since 1995, 188 athletes have died from blunt force injury to the heart. Of those 188 fatalities, mean age was only 14.7 years old, and 96% were male, according to the Heart Center. So you can, let's see here, in an effort to educate the public about the potential risk physically active youth can face, the NATA recommends that parents and coaches take proactive steps to protect their athletes against commotio cordis. That's that other page that you had, where it's the NATA official statement of commotio cordis. Okay? Holy smoke, let's see what the next slide is. It's done.